Healthcare professionals, while often acting in the best interest of their patients, can sometimes engage in unethical manipulation tactics that can severely affect both a patient's physical health and their trust in the healthcare system. These manipulation tactics can include pressure to make decisions quickly, the creation of dependency on unnecessary treatments, the exploitation of patient fears, and conflicts of interest within the healthcare system itself. Each of these tactics can lead to harmful consequences, not just for the individual patient, but for the healthcare system as a whole. One of the most common unethical tactics is the use of pressure in decision making. This can involve healthcare professionals creating a false sense of urgency, suggesting that immediate action is needed to avoid serious consequences. This pressure may cause patients to make hasty decisions, agreeing to treatments or procedures they might not fully understand or need. Such tactics can significantly undermine a patient's ability to make informed, autonomous choices about their care, leading to feelings of regret and diminished trust in healthcare providers. Over time, this can cause patients to feel that they are not in control of their own healthcare decisions, leading to frustration and a lack of confidence in the healthcare system. Another unethical practice involves creating unnecessary dependency on treatments or medications. Some healthcare providers may recommend long-term or even lifelong treatments, even when the patient's condition could be managed in less invasive or costly ways. This tactic might include pushing drugs that only mask symptoms rather than address the root cause, or suggesting frequent, unnecessary surgeries or tests. This creates a false belief in the patient's mind that they cannot manage their condition without continuous medical intervention. This manipulation can lead to unnecessary financial costs, side effects from prolonged treatments, and a sense of helplessness. As patients begin to feel reliant on treatments, their belief in their own ability to maintain their health without external intervention is eroded, which in turn affects their trust in the healthcare system. Exploiting patient fears is another tactic commonly used in unethical situations. Healthcare professionals might exaggerate the severity of a condition, using fear to push patients into agreeing to unnecessary procedures. For example, a doctor might present the possibility of a life-threatening outcome if the patient refuses treatment, even when the risk of the procedure itself may outweigh the potential benefits. This fear-driven approach can lead to patients making decisions they're not entirely comfortable with, under the assumption that they are acting in their best interest to avoid a worse outcome. The psychological impact of this fear-based decision-making is profound, as patients often experience feelings of betrayal, regret, and stress after the fact. Another factor contributing to unethical manipulation is the influence of external forces within the healthcare system. Doctors and healthcare professionals may face pressure from pharmaceutical companies, insurance providers, or hospital systems to recommend certain treatments or medications. In some cases, pharmaceutical companies offer financial incentives or perks to doctors who prescribe their products, creating a conflict of interest. This can lead doctors recommending medications or treatments that may not be in the best interest of the patient, but instead benefits the provider or the healthcare system financially. Such conflicts of interest undermine the objectivity of medical recommendations and contribute to an environment where profit may be prioritized over patient care. The cumulative effect of these manipulation tactics can have a profound impact on the relationship between patients and the healthcare system. As patients begin to feel manipulated or betrayed, their trust in healthcare professionals diminishes. This erosion of trust can make patients hesitant to seek medical care in the future, even when they need it the most. If patients feel that healthcare providers are motivated by financial gain or self-interest, they may avoid necessary treatments, delay care, or turn to alternative, less reliable forms of treatment. This ultimately harms both the patient's physical health and their mental well-being, as feelings of anxiety, confusion, and powerlessness take hold. Beyond the physical toll, the emotional consequences of manipulation are equally significant. Patients who feel manipulated may experience anxiety, guilt, and distress from making decisions they did not fully understand or agree with. The psychological burden of feeling that they were pushed into a course of action can last long after the treatment is over, leading to a sense of betrayal and emotional trauma. These feelings can prevent patients from seeking future care or trusting medical advice, which further deepens their mistrust in the healthcare system. In conclusion, Unethical manipulation tactics, such as using pressure to make quick decisions, creating dependency on unnecessary treatments, exploiting fear, and the influence of financial incentives within the healthcare system, all contribute to a breakdown in trust between patients and healthcare providers. These practices not only harm patients physically, but also have lasting emotional and psychological effects. To restore trust in the healthcare system, healthcare professionals must prioritize patient autonomy, informed consent, transparency, and ethical practice. Only through these means can the healthcare system truly serve the best interest of patients and rebuild the trust that is essential to the doctor-patient relationship.